If you are doing it right and you have proper processes, patient safety actually saves you money. And that's because patient safety goes hand in hand with equipment maintenance, with certain protocols, and it goes hand in hand with organization. And if you have all of those things, you actually end up saving yourself money.
Hello, everybody, and welcome to another episode of the Raving Patients Podcast. As you know, I'm your host, Dr. Len Tao. And first off, I want to thank the sponsors, both the Doc Sites and Dental Intel, for their support, allowing me to come to your inbox every single Friday at 5 a.m. So today's guest is Michelle Strange, and Michelle is a dental hygienist. She lived in South Carolina for her whole life, basically, and decided she wanted a different lifestyle during COVID. And now she's this roaming hygienist who travels across the country in nomadic lifestyle. She basically has created an Instagram handle called The Roaming Dental Hygienist, which is the RDH, which I think is fabulous. So please welcome to the Raving Patients Podcast, Michelle Strange. Michelle, thank you so much for joining me today.
Oh, I'm so excited to be on. I can't believe this is our first time being on a mic together.
Michelle was the original content creator for A Tale of Two Hygienists podcast, further demonstrating her commitment to advancing the dental profession through education and collaboration. To begin with, Michelle, again, thanks for joining me. Talk about how you decided to become this nomadic hygienist, going from place to place, how you ended up where you are now. I'm curious. I think the audience will want to hear that.
Yeah. So I started in dentistry at 17 and that's like my whole adult life has been dentistry. So I did dental on the job training for like assisting. And then I went to hygiene school, and I have ADHD pretty severely, late diagnosed, as most women are, millennial women like myself. And so I don't sit still for very long, and I like to be very curious and learn new things. And so I went to hygiene school, then I got my bachelor's degree and then my master's degree, thinking I would teach, honestly, in a hygiene program. And then I took a job with Tepe Oral Healthcare because I was actually using their products. Because most of my career, I have worked in, up until that point, until like 2013, in perio and implants. I did surgical assisting while being a hygienist. I've had a very interesting career. I never went into like general dentistry, clock in, clock out hygiene kind of world. And when I started working with Tepe, I started traveling as their educator for North America. My thesis was in oral care for critically ill patients and the hospitals to try to do pneumonia prevention. I just was on a CDC task force, which 12 years later, I'm finally using my thesis research. And I started traveling everywhere and learning from all of these people. And then that kind of was the impetus to me speaking all over the country, going to international conferences. And then 2020 hit and we all got stuck at home. And I genuinely just like looked around at, I know this probably sounds very harsh, but I looked around at the people in my life and the town I was living in. And I was like, I genuinely don't think I like any of you people. Like I genuinely have nothing in common with everybody. And I didn't realize it because I was traveling internationally. I was traveling the world, and I was getting my cup filled in so many other areas, as I traveled. So when I came home and just talked about just basic stuff and things that were just kind of what I feel like is a simple conversation, it didn't matter because I was having big conversations and, trying to change the world and do right by people as I traveled. So when I got stuck there, it was an eye-opening experience. And because I was traveling so much, I would go to these cities. Like I'd go to Missoula. Missoula actually has like multiple instrument manufacturers here. Isn't that wild? Like little town of Missoula. And so I'd come to Missoula because I'd learn about Paradise Dental Technologies and all the instruments they were doing. And I'd sit and look at the city and be like, this is a cute city. I wonder what it's like to live here. And so I always had this idea of like, wouldn't it be cool if I could go for like a year? That's all I had ever dreamt of, was like, go spend a year of my life, like spend 3 months in a city, kind of dust off the tourist, assimilate in the community, and then, go to the next place. And when 2020 happened, and then in 2021, when the prices of real estate went up, my neighbor sold her house with 0 renovations. And during the pandemic and before it, I was renovating my 4th house. I had gutted it. I had no kitchen as the pandemic was starting. It was like a little chaotic. And I was like, I don't know how I'm feeding myself because DoorDash is shutting down. And if there's no DoorDash, I don't eat, So it was wild. And I I just heard her be like, I just sold my house for a lot of money. And I was like, wait a second, what? And I called my friend who was a realtor and I was like, could I make some money on this thing? He's like, you got a house? I need a house. We need houses. Like, give me your house. And I was like, all right. So I literally sold my house. I actually got above asking. And because of that, I felt so grateful that I donated all of my furniture, everything to a, second home for women who are pulled out of sex trafficking and they go to their first home. And then the second home was like their next transition. So I donated all of my furniture and stuff to them. And I got the heck out of Charleston, South Carolina. And I have been roaming ever since then. And I was in Colorado the longest. I really loved Colorado because as a hygienist there, the opportunities feel endless. You have a lot of kind of free reign in your scope of practice. You can own your own practice. You can work. I worked in public health settings and long-term care facilities. I also worked in private practice. I just really enjoyed Colorado for all of those reasons. And now I'm in Montana and I'm doing nonprofit because public health is really where my heart and soul is. But I also love all the cool technology. So I always kind of creep back into private practice and work with cool stuff. And then I'm like, I don't really like it over here anymore. I'm going to go back to public health and I fill my soul with all the lovely things, kind of helping people reach or, I guess, eliminate barriers to care for dentistry in the US. And then I kind of creep back into private practice. I just kind of ping pong back and forth. One day I'll settle down, maybe.
You have that flexibility. I mean, that's great. And it's great. You travel where you want to travel. You're not tied down anywhere. And you like that lifestyle. Look, I travel a ton. I'm on the road almost every week somewhere. And during COVID, I was stuck inside as well. And I talked to my wife in 19 before COVID hit that I would consider moving to Florida at some point. And we put a 5+6 year plan on it. And when my son was out of high school and in college, and we were stuck inside during COVID in February and March in Philadelphia, it was cold. We just didn't like that. And I literally got tired of it. And I tell the story a lot. I woke up one day and I said, how would you like to move to Florida? She goes, no, we discussed this in like 5 years. And I'm like, no, we can do it now. And she was like, no, we can't. I'm like, yes, we can. You're not serious. And I remember my mother-in-law and my wife were in my company at that point, and they were like, you're not serious. I'm like, I am. I'll show you how serious I am. And I literally looked on Google, looked up, realtor in South Florida, called them up. They called me right back. And the next day we were down in Florida buying a house. So, I mean, it's a crazy story, but I understand how those things can cause you to want to make some significant changes. I like having a home base. I really do. And I don't think I can ever be a nomad in that sense, but I travel so much. So I understand the need or the enjoyment of being able to do that. So that's great. That's a great story. That really is. So your focus now, especially, when you teach has to do a lot with infection control. I mean, that's where a lot of your focus is in business as well. So can you talk a little bit about that? And I'm curious, how someone can, because I think you even mentioned during the one seminar I saw you speak at, was that, infection control can be a little bit boring. It's a more boring topic, and we want to liven up. But how can you make infection control fun, and how can you use it as a smart investing tool, smart marketing tool? Sorry.
Yeah, I guess it's one of those things. Well, I don't know if it can ever be fun unless you just genuinely love microbiology and systems and protocols. I think ultimately I am always like, what would I want as a patient when I've been hospitalized? I worked, like I said, I did my thesis in healthcare associated infections, pneumonia being the big one, and oral care. And, so I'm always kind of after, like, how can we do what we do, change people's lives for the better and not cause infections, make sure that they're safe. And, that goes far beyond even just like, do they have dental water that's not great and make people sick, but it goes to also like, are we extracting the right tooth? Are we doing right by the patient in all aspects of patient safety? And I started doing infection control. Well, honestly, it's been like my whole thing. Actually, I think my first job, it was in Perio where I did surgical assisting and hygiene. And somebody was like, why are you such a nerd with this stuff? And I was like, we got to make sure that we're barrier wrapping the right things. And I don't know, I just had this proclivity to like be organized, still do well in chaos, but like find systems and protocols that make our lives easier. And now that I temp as I go through the country, what I have been craving from these offices is standard operating procedures. Like, my thing that I always say is just because I have 2 thumbs and a dental hygiene degree does not mean I am an expert in infection prevention. I know how to do things. I can go through the systems and I can do the task. I can wipe a room down, but I am not an expert just because I graduated with any kind of dental education. And that goes the same for dental assisting. Depending on the state, like you either have training or you can be on the job trained. And this task of infection prevention falls so heavily on the dental assistant's shoulders. And so like, how can we come up with protocols that are going to keep patients safe? They're going to keep the team safe and quite honestly, save your practice money. Because I know that everybody sees infection prevention as this like, they're just telling me I got to buy this stuff. They're just telling me I have to use, throw my burrs away. And I've always used it as single use. They're just trying to get my money. Like I've heard it like my whole career, even before I was teaching infection control. But the reality is, if you are doing it right and you have proper processes, patient safety actually saves you money. And that's because patient safety goes hand in hand with equipment maintenance. It goes hand in hand with certain protocols, and it goes hand in hand with organization. And if you have all of those things, you actually end up saving yourself money. So for instance, when we look at equipment maintenance, the amount of offices that I have walked into where nobody is doing suction line maintenance, and you're like, it's not a big deal. And it is literally 5 minutes of my evening at the end of seeing patients, putting a bucket to a suction line, letting it go and flow through. It is the simplest thing, and it will save you so much money because how much does it cost to replace a vacuum pump? We're upwards of $30,000. It is a lot of money. And it is not one of these things where like if something gets clogged, we call Roto-Rooter and they come in, they dig it. Like we're ripping up baseboards, we're ripping up floors to find this, pipe that has the clog. So like creating protocols for your equipment and for your, devices. Here's another good example. How often has somebody used the wrong disinfectant on your very, very expensive intraoral cameras? And then all of a sudden the lens is fogging up. Now the buttons are all sticky. They're not clicking when you need them to. Well, if we had read those instructions for use and created a standard operating procedure for it, guess what? You wouldn't have to be buying a new one, right? So it goes from the big $30,000 to, mouthwash cameras are $300, but if you don't use the right disinfectants on it, you got to buy a new one. So I think from a marketing standpoint, you want to highlight that because patients, they're not dumb. Like I go into a hospital and I see signs everywhere that says like, make sure your provider is washing their hands. They're taking that knowledge and the things that are happening over there in medical and they're applying it to dentistry, especially after COVID, right? Like, are those instruments clean? Why aren't you washing your hands? They're watching. Not everybody, but some of them are watching. And you could really promote like how clean and orderly your office is because patient safety, in addition to the cool stuff that you're doing in your practice, is super important to you.
Now, I'm curious because we're on the infection control topic. And, COVID really put a focus on infection control and people were buying these suctions. They were buying these lights, these UV lights. They were buying all these, including me. I didn't buy one. I leased one for a few months. And I helped the guy promote it. It was this gigantic light. I needed to buy a special, door or to prevent the light from spreading too much. I don't know even how effective it was, but obviously, COVID put a lot of impetus on and focus on infection control and practices more than ever before. So I'm curious, just from your perspective, how many of those things ring true now when COVID is still around, but it's not as a pandemic like it was in that sense?
I would say one of the things that I kept hearing and saying often to people, they're like, "Why are we having to do all of these things?" I was like, I'm also not always super professional and I'm just over here like, bro, these are standard precautions that started 20 years ago. I actually don't know why you weren't doing 90% of the things that were are being recommended right now. All we did during the pandemic was take standard precautions and take it to our second level, which was transmission-based precautions. But most people couldn't get to transmission-based precautions because they weren't even doing standard precautions. They weren't even following a lot of the things that were already set in place. Like, we're like, make sure your dental water lines are, when did this start? I'm like, 2016. Actually 2013 is when we started talking about dental unit water lines. We're 10 years later now, and people are just now implementing testing and standards for their water. So I think what is sticking around since the pandemic that is a little bit newer is ventilation, is aerosol management. It is making sure that we're in these old buildings. I worked in an old house in Charleston, like we were making dental offices out of houses there because, we're in downtown Charleston, and those buildings are old and icky and like have HVAC ductwork from the 1800s. I know that's hyperbole, but you get what I'm saying. So I think we are really starting to understand, one, we should have a patient rinsing their mouths out for 30 seconds with a product that is going to decrease the amount of bacteria load in their mouth. We should be using high volume evacuation on all aerosol generating procedures. We should have proper ventilation or some kind of air purifier or disinfector in the operatory to help manage those aerosols that make it past our HVE. And I think we also learned that we were asking our PPE to carry a burden that it was never meant to carry. So yeah, we should be wearing proper mask and stuff, but that's not the only thing you are supposed to be doing. So when you look at the hierarchy of controls for decreasing your risk of being exposed to things, it is eliminate, it's substitute, then it's engineering controls, work practice controls. And then at the very, very bottom with it says least effective is PPE in this like triangle. And so I think those are the things that have stuck around, what we really learned from it. And I hope offices did go, oh, yeah, we should be upping our game in infection prevention. Like, this isn't just about COVID. It's about keeping patients safe, regardless of there being a, communicable respiratory virus in the world.
Interesting perspective on things. I believe it put a lot of focus on what we were doing, and I would say a lot of practices were somewhat lackadaisical in their infection control, and it put an onus on it. And like you said, there's some of the things that are basic things that we need to be doing. And a lot of the stuff wasn't done. Now you have to do it. So, I definitely, look, I'm not in practice anymore, but I know how that is. Let's switch gears a little bit. I'm curious your thoughts on patient engagement, where you see the future of that is. So can you touch base on your thoughts on that right now?
Yeah. So my other passion in dentistry is helping patients be successful at home. And I have very much changed my opinion on how you engage patients. I definitely came from more of a provider center approach, very like floss the teeth you want to keep. If you don't want to like lose any of these teeth, you got to start caring for them. And it's very fear mongering. It's very fear based. And I am moving more towards patient centered care. So I practice something called motivational interviewing, where you center the patient, you meet them where they're at, you help guide them to behavior change by moving them out of ambivalence. And that happens with a lot of open-ended questions, a lot of listening, a lot of pivoting, or just really, I think open-ended questions is one of the biggest ones. So you ask them and so I don't say, are you flossing your teeth every day? I'm like, what products do you like to use to clean between your teeth? Like, that's such a different question, right? One that I use often is, what do you like to do at home to keep your mouth healthy? And most people give me this like, what? I'm like, what products do you like to use? Do you have like a favorite toothbrush right now? Do you have a favorite toothpaste right now? And I'm doing multiple things with this type of question. And that is, I'm making it a bit positive. What do you like to do to keep your mouth healthy? Not what are you not doing to keep your mouth in disease? It's a positive approach to this. It's also putting, hopefully, a lot of emphasis on the products they choose to use in their bathroom or throughout the day. That is what is going to help manage their mouth and disease or maintaining health. And it's opening the question for them to kind of go, well, and then I always get, well, I'm not flossing enough. And my answer is always like, well, I don't care actually. What do you like to do to clean between your teeth? Like, what do you want to do? And there's just so many options out there for patients. And, this conversation really helps guide me into things like discussing pH of their mouth, lip closure, airway issues, sleep apnea issues, all the other things that are not me cleaning somebody's teeth and then brushing their teeth, right? So I'm really looking at the patient as a whole and engaging them to have this conversation so they don't feel the shame, they don't feel talked at, and they don't feel as if I am centering me, myself, and all of my knowledge versus them and their autonomy and what they might or might not want to do. And so that is what I have been doing. And it has literally changed who I am as a clinician. And I know that sounds very like, I don't know, puppies and rainbows. Like how could it be that easy? But honestly, it has changed me because what I used to be was a disheartened hygienist. I used to feel like I would talk to these patients. I cared so much about them getting healthy, and they'd come back. And then what would happen? Oh, I didn't know I was supposed to be using that product. Or like, oh yeah, like I think you said that last time. And I was just getting nowhere with them. And I was becoming burnt out and disheartened, and it was exhausting. And if they came in and was like, Dr. Oz said should be doing this, I'd want to take my head into the wall behind me because I'm like, are you kidding me? Like, I've been saying this for literal years. Are you kidding me? And I'd get so frustrated, but it was because I was just like making them my dumpster for information. They were my information receptacle, the trash can for all my knowledge and the things I wanted them to do. And I would just unload on them. And now I engage them. Because if you only give them like, what's the quote? I'm so bad about remembering quotes exactly, but it's something like, if you never give them a chance to make a decision, they're only left with no. No, I'm not interested. You didn't give me any choice, but my only choice that I feel right now in my autonomy is no. And I'm going to say no here. And that's what I was doing to my patients. So now that I'm practicing motivational interviewing, I'm doing guided biofilm therapy, which we can definitely talk about, but a big chunk of that theory and that therapy is motivating the patient. And it has changed everything for me, because now I am not like, why aren't they listening to me? And I'm listening to them. And it's so amazing. And I'm getting such great feedback from them. They're happy to be there for the most part, not all of them, right? But for the most part. And they're accepting treatment. And that's all I ever wanted.
I've always been about empowering hygienists to do other things. So I'm curious, what suggestions would you have? There are so many hygienists who literally, and I want to use this cautiously, they feel like tooth cleaners. They just, all they do every day is they polish and clean, polish and clean, polish and clean, and they don't do anything else. So I'm curious, what should a hygienist strive to do so they can bring other aspects of what they learn to a practice? So a better way of saying it, what techniques can they learn to help grow their practice or help the dentist grow the practice?
Gosh, there's so much out there now. Now, I will say, depending on the state that you're in, that depends, because honestly, some of these state practice acts are so limiting, and it's very frustrating to be a hygienist that was in South Carolina and was limited, and now to be in Colorado where I could do minimally invasive therapies and restorative treatments and own my own practice. Like now I feel like, yes, I can actually work at the height of my education and scope of practice. Some of the things that I'm doing right now are, like I said, minimally invasive therapies. So doing glass ionomer sealants, using the new product called Curodont, doing SDF, really kind of seeing those patients that are saying no to your fillings, but I could still be doing some other stuff over here on my schedule and my, column and making the practice money. Sleep evaluations, hygienists are the amount of sleep issues that I see, or airway issues, I should say, that then lead me to a conversation about people's sleep is crazy. They are your catalyst to that department, sleep, if you're thinking about sleep dentistry. Myofunctional therapy. So I'm certified in myofunctional therapy, and I see so many patients that I could be treating the outside of, cleaning their teeth. I would also say guided biofilm therapy. So that is a thing that it has been brought to the US from EMS, which is a Swiss company, and they have the airflow prophylaxis master. And it is a minimally invasive approach to the hygiene appointment. So my goal is to actually not scale teeth anymore, which is wild because I thought I'd die with my sickle scaler in my hand, right? Like gripped in my dead cold hands. But now I am actually trying not to scale teeth. So people are enjoying their appointments more. We're really trying to get after prevention and maintaining health so that I can have these other conversations. So now they're like, oh, you're not chasing this crown that I needed to do or this new filling in the back. What about those veneers? What about whitening? What about these other, like maybe I am ready for clear aligners. So if we are really going after patient motivation and prevention, we're allowing patients to then look at their body, sleep, tongue posture, cosmetic stuff that they've been wanting to do. I think there are so many things that hygienists could be doing these days. And I think as a practice owner, it's about giving your hygienist autonomy, valuing their input, because that is honestly probably the one thing that has, I guess, prohibited me from giving a crap in an office. Because I've worked in it both. Like I've worked in an office where they were like, well, let's ask Michelle. Michelle's the literal expert on oral hygiene instructions. Like, let's ask her about this. Michelle just went to a course on minimally invasive techniques. Like, let's talk to Michelle about this new thing that we could be implementing. They valued my input. And I've been in a practice that was always like, Michelle, another thing? You want to bring in another thing? Michelle's always asking for this stuff. And I was seen as the pain in the, squeaky wheel. And that is, which then just kind of stifles me. And then I get into that, like, well, I don't care. If you're not going to value it, I don't care. So practice owners, I would say, make sure that you are valuing, the input and the desire to have more education from your hygienist. And hygienist, go out there. You are more than a scaler. You are more than a scaler, and I need you to hear that. I need you to believe that. You are a healthcare provider. If you haven't been valued, don't worry. There are people that will value your information. Don't stop educating yourself and don't stop loving this career because it is more than scaler to tooth. It is.
Well, I think that's a great way to end the content portion of it. I think that was a really great way you just ended it right there. So I want to switch gears. I do a little exercise. It's called the lightning round Q&A. So these are business related questions, Michelle. And for those that have not heard them before, they're all related to running a business or having a business. So I'm going to read you some questions. The point of this, Michelle, is to answer them as quickly as you can. No long drawn out answers. We're going to try to get through 8 to 10 of these very quickly. Okay.
Okay.
First question. What eats up most of your time that you'd like to change?
Oh, social media.
Describe Monday for you in one word.
Emails.
Who has been your greatest inspiration?
Women. I would just say across the board, women in dentistry.
What do you think your unique skill is that has helped you become successful?
Being loud.
That's a good one. Do you keep a journal and does it help you?
Yes, I do have a journal and it does help me. Absolutely.
Got it. What distracts you most every day?
Social media.
You got to get off that social media. So what business related book has inspired you the most, or what is your favorite book?
Checklist Manifesto.
That's a great book. I like that. When you were a kid, what was the first thing you wanted to be when you grew up?
Lawyer.
This is a tough one. What is your greatest fear and how do you manage that fear?
This is going to sound wild, but being dumb, being like uninformed is a fear of mine. And I consume content like that is my job.
I know you're a podcaster just like I am. So do you have a favorite business podcast?
No, I don't have a business podcast. I think I listen to things now that are gonna, I guess, be more fun. But I say that, and one of my favorite podcasts is Crime Junkies, which is really fun. But I'm just trying to learn how not to die.
Nothing wrong with that. Okay. Last one. What is one subscription, but either personal or business, that you cannot live without?
DoorDash.
That's a new one. I haven't heard that one before. So that was a unique one. So that was great. Thank you for partaking, Michelle. I hope you enjoyed that. So Michelle, I know you have a guidebook that you have available. Why don't you tell people a little bit about the infection control guidebook, how they can get it? And I know you wanted to give an offer to the audience as well.
Yeah, so I just launched something called the Infection Control Coordinator Guidebook. Really, it manifested because I was trying to help an office get their infection control record keeping and everything together because there was a potential for an audit from the state board. And they wanted me to do it while I was seeing patients. And I, the expert that I am in this space, was overwhelmed. And I was like, well, if I'm overwhelmed, I know people who don't want to be doing this are going to also be overwhelmed. So I created this guidebook that has all the sections that you could ever need for record keeping, anywhere from eye wash station maintenance and the logs. And each section has SOPs. So you would write in there what's happening in your practice. And it is just hopefully a complete guide. It has labels. It has stickers for the creative people out there. It's fill in the blank for the most part. And it is for your day in, day out stuff. This is not OSHA. I always try to make sure people understand that this is not your OSHA written stuff. This is your day in, day out stuff. How are we maintaining that $30,000+ vacuum pump so that you don't lose it? And so it's called the Infection Control Guidebook. You can find that at my website, levelupip.com. And I do have a code that I would love to share with your guest or your audience listening. And it's going to be for $25 off. So at checkout, they can just use the code RAVING and they will get $25 off.
That's great. And Michelle, if anybody is listening to you, a hygienist or even a doctor, and they want to pick your brain or they want to learn more about how you can help them, what's the way they can get in touch with you? I know you're all over social as well. So
yes. So I have two companies. I know it gets a little confusing, but for me, Michelle, the hygienist, that is not infection control. You can find me at michellestrangeRDH.com or on TikTok and Instagram as the roaming dental hygienist. And if you are really wanting to, I don't know, bring me in as a speaker or something for infection control, help your office or buy this book, you can find me at levelupip.com and on Instagram and TikTok as Level Up Infection Prevention.
Well, this was great. Guys, hey, if you're a hygienist, I hope you enjoyed this. I don't do a ton of with hygienists, but I brought this for you guys. So if you did, I hope you enjoyed it. If you're a dentist and you thought, you really, Michelle said what hit home to you, reach out to her, learn more about how she can help your practice. Get her infection control guidebook that she talked about. You get $25 off with the code RAVING. And Michelle, thank you so much for joining me today. I hope you enjoyed your time here. And as I end all of my podcasts, remember, your reputation matters. Until the next episode, thank you so much for joining me, Michelle, and we'll talk to everyone soon.
Thank you.